Good morning and welcome to another episode of Speaking from the Heart with Dr. Afshine Emrani. I want to thank you for all your support of this program and thank you for the emails that you have sent me at dremrani@gmail.com. Today we will speak about hypertension, which is what many of you asked about. Hypertension is an elevated blood pressure and it has different meanings to different people. Now the majority of hypertension is what's called essential hypertension, which means that we really don't have a cause for it. It's a minor part of hypertension is what we call secondary hypertension, which means that it's secondary to other diseases such as kidney failure or medications or perhaps even pregnancy and so on and so forth. But we will focus on primary hypertension, which is the majority of hypertension, which is essential hypertension, or what we don't really have a cause for. Many people, as they get older, develop hypertension and it becomes a chronic disease of aging as the arteries become harder and the heart, as it pumps stiffer and harder, the blood pressure starts to rise. Now, hypertension is known as a silent killer or a silent disease because most people don't have any symptoms until very late stages. So most people, for example, at a blood pressure of 160/100 will not have any symptoms, and that could put them at risk of having a stroke or having a bleeding inside the brain as the pressure rises inside the brain and pops those vessels and causes a bleeding or a major stroke. High blood pressure can be anything over 145 in the systolic, which is the top number, or over 85 from the diastolic, which is the bottom number. Now, systolic is when the heart squeezes. When the heart squeezes, that's systolic blood pressure, that's the top number, and then as the heart relaxes, that's the diastolic number. So systolic, diastolic, that's the top number and the bottom numbers. Now, what we want to do is we want to keep these numbers within the normal range, which for different people mean different things, but if you have no health issues, then you want your numbers to be less than 140/90. If you have one or two medical problems such as chronic diabetes or kidney disease, you want it to be less than 130/80 and then less than 120/70 if you have heart failure or chronic heart disease, so that the heart that's pumping is getting tired and you want the blood pressure against which it pumps to be lower. So you have to work with this with your doctor to figure out what's the best number for you based on the whole information that they can get from you. It is important that you figure out the right medication for you, as it can be different based on your nationality, your age. There are ACE inhibitors, ARBs, calcium channel blockers, beta blockers, and then there are diuretics. Now, as you get older, or for African American patients, it's important that you watch your salt intake. Salt intake is extremely important. Also, I will talk about this in another program, but your body has a natural thermostat for which if you gain more weight or if you become less active, your blood pressure tends to rise. So it's imperative that you do lifestyle modifications such as watching your salt intake, not adding salt, and making sure you keep your weight down and you exercise. You also have to make sure that you don't have other medical illnesses such as sleep apnea, exogenous obesity around the waistline, and or taking medication such as Sudafed for your cold or sinuses that can increase your blood pressure. So these are things that your doctor will figure out with you over time. It is important that you measure your blood pressure early in the morning. Please get a cuff, not the ones that go on the wrist, but the ones that go on the arm, and measure your blood pressure for 2 weeks early in the morning in your natural home situation, and then you can either email this or fax this to your doctor and see what your doctor recommends for you for your blood pressure as time goes on. I will stay in touch with you regarding your body's natural thermostat, as I mentioned, and I appreciate all your support support of this program. And should you have any questions, please email me at dremrani@gmail.com. And please go to my website at laheartspecialist.com, where there are a lot more information. Thank you.